My name is Mary Jocelyn Gonzalez, and for today's case study, I'm going to present a 67-year-old woman presenting with dysphagia, chronic cough, and feeling a swallowing material sticking in the throat. The physician has requested an esophagram to confirm the diagnosis of Serge diverticulum. Patient presents no history of surgery or allergies. Patient demographic history includes sex, age, race, ethnicity, and preferred language. The primary diagnosis for the patient was dysphagia. This means difficulty swallowing. It takes more time and effort to move food or liquid from your mouth to your stomach. Dysphagia may also be associated with pain. In some cases, swallowing may be impossible. The physician has requested an esophagram test. This is a series of X-ray pictures of the esophagus taken with fluoroscopy. The barium is a type of contrast that helps to see the wall inner of the esophagus. Once we have checked the demographic of the patient and the order of the exam, we are going to introduce ourselves to the patient and we are going to identify the patient properly. This means two different types of identification at least. One, we are going to call the patient for the name, and then we are going to ask to confirm the date of birth. Also, we can check the wristband and make sure we have the right patient. Then, we are going to explain to the patient the procedures and the duration of the exam. We are going to ask the patient when was the last meal, because for this procedure, the patient needs to have the stomach empty, or at least not eat or drink anything for at least 4 hours before the exam. During the procedure, we are going to ask the patient to change into a gown and remove every kind of jewelry, for example, earrings and necklaces, or if the patient is a woman, the bra. Then we are going to explain that the exam will perform it on a tingling table. This means the table is going to move from a stand to completely lay down. For these procedures, is going to be a first portion and a second portion. For the first portion of the study, the patient is going to be a stand and drinking for a cup and drinking barium from a cup. The radiologist will ask to the patient to move in different positions. This includes LPO and AP position. For the second part of the exam, the patient is going to be lie down on the table, and the doctor can ask for different positions. For example, RAO, AP, PA, or LAO. After the procedure, the patient needs to drink plenty liquid because the barium may sometimes cause constipation. The barium also is going to make the stool look red or white, and the result for the test is going to be ready in at least 2 days. It's responsibility of the technician set up the room, take a scoped image before starting the procedure, have the patient swallow the easy gas, and position the patient in different positions. The patient needs to drink the contrast according to the radiologist's instruction. The technique for the procedure. The technique is going to follow the oral administration of effervescent granular, which is the easy gas, and barium. The esophagus was evaluated from the upper esophagus to the gastroesophageal junction with fluoroscopy, the spot view, and overhead field. For the overhead field, we are going to use a 40 SID and 100 to 120 kbp. The image on the screen is a lateral oblique image of the esophagus with dual contrast, this means barium and air. This reveals a posterior outpouching of the esophagus, filling with barium. This type of outpouching is known as a Serge diverticulum. contrast, filled pouch protruding dorsal from the hypopharynx at the level of C5 and C7.
According to the radiography report, this patient presents an upper esophageal diverticulum because the contrast filled the pouch at the level of the C5 and the C7. The treatment for this condition in more severe cases may require surgical to remove the pouch and repair the weakness tissue in the esophagus. This surgical procedure is called crypopharyngeal myolotomy. This involves making a small cut in the upper sphincter of the esophagus to widen it so food can pass more easily through your esophagus.